Good day everyone, my name is Yi Tze. You can call me Catherine as well. Today, I'll talk about urinary system. Urinary system works as body filtration system. It removes toxin and waste from body as urine through urethra. First, I'll introduce some main organs in urinary system. Include kidneys, which are the blood filtering organs, ureters, ducts that connect kidneys to bladder, an organ that holds urine, urethra, a tube connected to discharge urine, and finally the sphincter, the circular muscles that regulate flow of substances. Kidneys have two main functions, which are excretion and osmoregulation. As an excretory organ, the kidneys excrete toxic waste such as urea, uric acid, ammonia, and creatinine. As an osmoregulatory organ, the kidneys control the total volume of water in body fluids, the concentration of ions in body fluids, blood osmotic pressure, which is the concentration of dissolved materials and volume of blood and body fluids. Lastly, it controls the electrolyte content and pH of blood and body fluid. The main functions of urinary system is to filter the blood, separate the toxins from the nutrients, store and carry urine out of the body. There are four main processes occur in urinary system. The first is glomerular filtration, which occurs in Bowman's capsule. The blood entering the glomerulus is under high hydrostatic pressure because the diameter of the afferent arteriole is larger than the diameter of afferent arteriole. The pressure causes glomerular filtration to occur, that is, fluid seeps through the wall of glomerulus capillaries into the cavity of Bowman's capsule. The fluid that enters Bowman's capsule is known as glomerular filtrate. The glomerular filtrate has the same composition as blood plasma but does not contain red blood cell, platelets, and plasma protein. Red blood cell and plasma protein remain in the blood, flowing to the afferent arteriole because the size of these substances is too large to seep out of the glomerulus. Next, the process is reabsorption. It occurs at the proximal convoluted tubules, loop of Henle, and distal convoluted tubules. Reabsorption of the glomerular filtrate occurs along the renal tubule. The dissolved substances permeate across the renal tubular walls into the blood capillary network. In the proximal convoluted tubule, sodium ions are actively pumped out into the blood capillary network, and chloride ions are passively absorbed. The reabsorption of 100% glucose and amino acids also occurs through active transport. The movement of dissolved substances into the blood capillary network reduces the concentration of dissolved substance in glomerular filtrate but increase the concentration of dissolved substance in blood capillaries. As a result, water can enter the blood capillary through osmosis. In the loop of Henle, water is reabsorbed through osmosis. Sodium ions are reabsorbed through active transport. In distal convoluted tubule, more water, sodium, and chloride ions are reabsorbed. The amount of water and salts reabsorbed depends on the water and salt content in the blood. The third process is secretion. Secretion is the process of secreting waste materials in the blood that were not filtered earlier into the renal tubules. This process is totally opposite to the process of reabsorption. Secretion occurs along the renal tubule and collecting duct, but is most active as the distal convoluted tubule. Secretion occurs through simple diffusion and active transport. Substances that are secreted include hydrogen ions, potassium ions, ammonium ions, urea, creatinine, toxic substances, and some drugs. Secretion gets rid of toxic waste and helps to regulate the levels of ions in the blood. Lastly, the urine formation. When the renal fluid reaches the collecting duct, only a small amount of salts are left, and most of the water has been absorbed back into the bloodstream. The remaining renal fluid is now called urine, flows down the collecting duct. Here, a small amount of urea will diffuse out into the surrounding fluid and blood capillaries due to its small molecular size. While urine contains water, urea, sodium chloride salt, uric acid, and creatinine. After leaving the collecting duct, urine flows through the ureter, bladder, urethra, and is finally excreted out of the body. Now, I'll talk about a disease related to urinary system, which is chronic kidney disease, CKD. The symptoms include high blood pressure, urinating more or less, and edema. The causes of this disease can be cardiovascular disease, abnormal kidney structure, or family history. While for the suggested treatment are kidney transplant, dialysis, or change the lifestyle. Now we have the technology hemodialysis machine to treat the kidney failure. But how it works? First, the machine filters and cleans patient's blood outside body, uses a dialyzer to remove waste products and excess fluids, mimicking the kidney's function. Blood is pumped through machine where it is purified and returned back to the body. This machine helps to manage kidney failure, maintain fluid and electrolyte balance. And lastly, I'll introduce one well-known nephrologist in the world, who is Dr. Barry M. Brennan. He served as the chair of the Department of Medicine at Brigham and Women's Hospital and was a faculty member at Harvard Medical School. He conducted groundbreaking work on the mechanisms of glomerular filtration and launched the first edition of the Brenner and Rectus the Kidney, the world's foremost textbook of nephrology. And until now, that's all from me. Thank you for your attention.